Coming up on Medical Economics Weekly, doctors aren't using mobile tech. ConsultingMD raises $10 million in funding, and should nurse practitioners play a greater role in providing primary care? All of that and more coming up. You're watching Medical Economics Weekly. I'm Kevin Stout.
I'm Brandon Glenn, and this is the show where we keep you up to date on trending news about healthcare, practice management, and healthcare social media.
Chuck Klosterman wrote an interesting reply to a physician in the ethicist column of the New York Times. The physician is facing a bit of a moral dilemma. A patient he had taken care of in the past disclosed that he had committed a serious crime and allowed another person to take the fall for it. The doctor had assured the patient that whatever he said would not leave the room. Even after the hospital lawyer told the physician that they were under no legal obligation to report the incident, the doctor's moral obligation seemed to be weighing on him. Klosterman leaned heavily towards urging the patient to confess his guilt and for the doctor to break his promise of confidentiality if the patient refused. He admitted that most doctors would probably disagree with his stance and that even he was uncomfortable with his own advice. The main part of his argument is that it's ethically wrong to break confidentiality, but even more so to allow an innocent person to go to jail for no valid reason. The doctors of Medit were up in arms about this particular case. Most seemed to strongly disagree with Klosterman's advice. These doctors seem to be more interested in the professional consequences of the issue than the morality of it. Many seem to think that if an ethics committee decided on keeping confidentiality, the doctor should simply deal with his feelings about the case. What do you think about the case? Let us know by mentioning us on Twitter at MedEconomics, on Facebook, or email me at kstout@advancedstar.com.
We hear a lot about the mobile healthcare revolution and the rise of mobile technology in general. So a report from consulting firm Deloitte had us raising our eyebrows a little bit. A 613 physician survey found that 57% of physicians do not use mobile technology for clinical purposes, such as accessing electronic health records, e-prescribing, or communicating with patients. What's more, of these doctors who aren't using mobile for clinical reasons, 78% say they have no intention of doing so in the near future. More broadly, the survey reveals a wide gap between physicians who are adopting technology and physicians who are keeping it at arm's length, according to Dr. Harry Greenspun, an advisor with Deloitte. In the future, Greenspun expects that consumer demand will pull some of the more hesitant doctors toward wider adoption of technology.
Health startup ConsultingMD has recently secured a $10 million funding round led by venture firm Venrock. The idea behind ConsultingMD is to allow for patients to receive second opinions virtually. ConsultingMD connects patients with leading medical experts in less than 48 hours. And instead of using thousands of doctors for this service, ConsultingMD has the goal to keep that number low. Founder Owen Tripp was quoted by VentureBeat describing ConsultingMD. "We don't believe you need a network of 30,000 doctors to be effective. We would rather use the same 750 doctors who achieve successful outcomes again and again." ConsultingMD has been selective about its pool of experts so far. They grew their group of specialists based on recommendations only and have been receiving more requests from other doctors to join them than the team can handle. ConsultingMD has some powerful features. The patients only need to provide some brief details about their case and sign a release. After that, the technology begins to assemble a file on the patient with full medical records, demographic information, images, tests, and more. After that, it selects the most relevant specialist from the network to give his or her second opinion. ConsultingMD is HIPAA compliant and cloud-based, so doctors can review these cases from their iPads in what the founder called a virtual clinic. Tripp also has a second product plan that helps patients schedule visits with nearby specialists.
Research published in the New England Journal of Medicine last week shows there's a very wide gap in how nurses and physicians perceive the quality of care provided by nurse practitioners. This relates to one of the biggest debates in medicine right now called scope of practice. The question here is, if the U.S. is facing a big shortage of primary care physicians, could nurse practitioners provide some primary care services? The new survey shows just how much physicians don't seem to like that idea. A couple examples. When asked if physicians provide a higher quality of care than NPs, 66% of physicians thought so, but only 25% of NPs did. When asked if NPs should be paid the same for providing the same services of doctors, 64% of NPs thought so, but only 4% of physicians did. The study's lead author marveled at how wide of a gap in perception her study showed, and essentially issued a Rodney King-like plea of, can we all just get along?
Forbes reports some good news for young athletes with defibrillators. A recent study found that participants with ICDs could play sports more vigorous than golf or bowling without major problems. While advice from the American College of Cardiology is not to play these sports, the study seems to contradict that stance. Over the 2.5 years of the study, not one participant died, needed to be resuscitated, or suffered a severe arrhythmia-related injury while playing sports. The study discussed the emotional aspects of restricting sports for athletes with ICDs, as well as the physical. They mentioned that athletes sidelined by these injuries score lower in quality of life scores than healthy athletes and non-athletes alike. These patients report not feeling normal due to sports restriction as one of the most negative parts of using their device. The authors of the study concluded saying that a blanket recommendation against competitive sports for all patients with ICDs is not warranted. There are risks and benefits of sports participation. However, neither do these data suggest that all sports are safe for all patients.
Physicians, if you hand out patient education materials, you probably don't want to get those educational handouts from specialty societies. A recent study in JAMA Internal Medicine shows why. The study examined educational materials from 16 specialty societies and found that all of them were written at too high of a reading level. According to the study, the average U.S. adult reads at a 7th or 8th grade level, so medical groups like the AMA and National Institutes of Health recommend patient education materials be written at 4th to 6th grade reading levels. The researchers ran patient education materials through a software program that performs readability analysis, and it found that none of the educational materials met even the 7th or 8th grade reading levels. The researchers recommend that specialty societies rewrite their educational materials with greater clarity and use videos and pictures when information is too complex to explain by text alone.
Recently, cloud storage technology Box received HIPAA compliance certification. This recent certification may make Box the default system for healthcare developers to store patient data and new technologies that may need to access patient health records, medical images, payment information, and more. With Box at their disposal, developers can focus on the interface and usability of their technology without worrying about storing the data itself. Using Box's technology, that data can simply be stored on the Box servers. Box CEO Aaron Levy took the stage at HealthBeat conference to talk about Box and its new HIPAA compliance certification. He was quoted saying, "There's not that much tech that's actually sanctioned that has this consumer experience. We really want to be the underlying layer for how content gets stored and shared." One startup that Box has recently acquired, Crocodoc, may be the first of many to use its cloud storage. The startup takes different kinds of documents and translates them into HTML5 interactive experiences. Box claims that it will start looking at translating EHRs as well as medical images in the future. And now for our tweet of the week. In reply to an article in the Wall Street Journal about declining costs of retirement, user Caroline McSee replied, "This is based on populations, not individuals. Each person should look at their potential healthcare usage to decide." Thanks for your feedback, Caroline McSee, and to be featured here, mention us on Twitter at MedEconomics. Thanks for watching Medical Economics Weekly. To get more episodes as they're released, please subscribe to our YouTube channel, follow us on Twitter at MedEconomics, or like us on Facebook at facebook.com/medicaleconomics. And send suggestions and feedback to bglenn@advancedstar.com or kstout@advancedstar.com. Thanks for watching, and we'll be back soon with more healthcare and practice management news. Don't miss it.